Focusing on antidepressants. So you might wonder as to antidepressants, just like antibiotics which are used in infections. So antidepressants might be only used in depression. But remember, antidepressants currently has many indications, okay, apart from depressive disorders. So mainly depressive disorders are the main indications here, wherein you have major depressive disorders, you have dysthymia, okay, even grief reactions. So these things get covered under depressive disorders. There are disorders like OCD and anxiety disorders. Even in this, antidepressants are used. Anxiety disorders can be panic disorder, GAD, phobias, social anxiety disorder. But only in case of OCD that the dosage which is given in a higher dosage than that is given in depressive disorders. We have eating disorders like anorexia nervosa, bulimia nervosa, then impulse control disorders. Okay, we have kleptomania, pyromania, gambling. Also, in terms of substance abuse disorders, it is used as anti-craving agent. Okay, so continuing further, it is also used in PTSD. You have child psychiatric disorders like enuresis, ADHD. So we have also some of the personality disorders wherein impulsivity and chronic depressive symptoms which might also resolve. Okay, so these are the various indications in which antidepressants from different groups are used. Coming to the classification of it, so broadly at least you need to know that tricyclic antidepressants, short form is TCAs. This is the first group of antidepressants that were historically of significance. Then we have SSRIs, that is selective serotonin reuptake inhibitors. We have MAO inhibitors, that is monoamine oxidase inhibitors. Then we have other atypical antidepressants. Okay. One common thing that needs to be remembered here is that antidepressants works with a common principle that the monoamines, namely serotonin, dopamine and norepinephrine, so these levels are increased in the synaptic cleft. So the whatever the specific mechanism of action be, so ultimately it results in this increased levels of monoamines. Okay, so under TCS we have one commoner drug, that is amitriptyline, imipramine, you have clomipramine, nortriptyline, dothepin. Okay, so one need to remember which class they belong to. Here it is triptylins or pramines, so that it ends with those suffixes. Okay, coming to SSRIs, we have this is a commonly asked group of medications. That's the reason why you need to remember each of these drugs. Escitalopram, you have fluoxetine, you have paroxetine, fluoxamine, sertraline. So other than escitalopram which ends with pram, so oxetine or fluoxamine, sertraline. So these are the cues that you need to remember with regard to SSRIs. Coming to MAO inhibitors, though clinically not often used, only in case of resistant depression. We have phenelzine, tranylcypromine, selegiline, though antidepressant effect is lesser. Okay, and coming to the atypical antidepressants, here various permutation and combination of these three monoamines like serotonin, norepinephrine, and dopamine action is seen. So some of the examples are SNRIs, wherein selective norepinephrine reuptake inhibitors, or SARIs, selective adrenaline reuptake inhibitors, okay, or only a combination of dopamine and norepinephrine, or dopamine and serotonin. So few of the examples here are venlafaxine, bupropion, you have mirtazapine, trazodone, okay, you have tianeptine. So these are the atypical antidepressants that are used of clinical use. Okay, so remember there are tricyclic antidepressants, SSRIs, MAO inhibitors, and atypical antidepressants, which are the major group of antidepressants.